Good morning, Patrick here from Complete Health. And I just wanted to let you guys know that we have our next advert live for the next spinal screening that we're doing in the clinic. So the spinal screening will be running not this weekend, not next weekend, but the weekend following. So that's not this weekend, not next weekend, the weekend following. That's the dates of the 8th and 9th of May. It's the 8th and 9th of May. So what do we do? What is a spinal screening? What is a posture check? So what do we do? Well, we take a photo of someone from the front and from the side. And what we'll be able to do is use certain landmarks to exactly pinpoint where that person is starting to change their posture. Now, I've been using this software and I've been using these checks for the last really 2 to 3 years with my clients. And it's quite impressive, actually. We can see up to an 80% change in people's posture in the first 3 to 4 months. Now, why is that so relevant? Well, if we think about posture, what actually is going on? What is posture and why is it important? Well, posture is a chiropractor's understanding or gateway to understanding what is going on with the person's skeleton, what's going on with the person's muscles, but most importantly, what's going on with that person's brain and central nerve system. Because the reason why that's so important is that the brain and the nerve system is what controls all the other systems to do what it's supposed to do. So if we see that someone is starting to slouch, essentially what that person is doing, their brain is sending the signal to the muscles that will tell their body to slouch, which is why you can prompt someone that has got bad posture to sit up straight. However, it will feel really uncomfortable after a specific period of time, and they'll pretty much always go slumping back to that place they were before. Now, the great thing about posture, for me, it is a really good predictor, along with a couple of other tests that I can use, as to whether that person has already got an injury or whether that person is going to develop an injury in the future. So, e.g., let's just look at something like a forward head posture. If someone is slouching all the time, it is really common for those people to start developing things like headaches, neck pain, shoulder pain, etc. But even with the forward head posture, now it's interesting because if you take someone that's got a really slouchy posture and you start to traction on their neck, it's amazing how many patients will tell me that they can feel the stretch all the way down into their lower back. And why is that? Because if we're stretching the neck, why on earth would someone's lower back start to then stretch as well? Well, what we know is the spinal cord is running directly down the middle of the spinal column. So if you stretch someone's neck and there is tension in that spinal cord because of the way that someone is starting to change their skeleton, that person will get pulling and tugging as the spinal cord runs down the middle of the skeleton. So like I say, the posture is a great way for us to get in and get a gateway to understanding what's going on with that person's body on the inside. So these checks are completely free. We do these weekends completely free of charge. However, all we have to do at the moment is, because of the current COVID restrictions, is get people to book a ticket and allocate a specific time so that we can make sure that everything is done appropriately. We will always offer an opportunity for people to understand a little bit more because, as many of us know, that understanding the initial things with your posture is great. However, most people will want to know how to fix it as well. And we will give people options and guidelines as to what options they will have with us. We obviously, in this clinic, we would do full physical examinations for new patients. So if people were interested in doing this after having a posture screen, we would have options on how people can gateway into that. Now, we also have clinical x-ray. Now, great thing about the posture screenings that I do, when we do the posture screens and we check for people's alignment and we can see someone is leaning very severely to the left and we take an x-ray of their low back, guess what we almost always find? Almost exactly the same thing. So the great thing about the posture checks is I can use these as many times as I want as that person is going through their care, and we can start to measure and see the changes. So we know if we're changing your posture, we're starting to change your skeleton. If we're starting to change your skeleton, we know we're starting to change your muscles. If we know that it's starting to change your muscles, guess what? We've influenced the brain. And this is essentially the way that we've been working with all of our patients here since I've taken over Complete Health. And what we've seen is the results are 99% of the time, pretty amazing, and sometimes they even astound me. So again, I had a gentleman not that long ago who had a forward head carriage of about 6 inches, and we've managed to get him down to about 2 in the first few months. And it's just amazing how much different he looks, but also how much better he feels. So if you're interested, like I say, the tickets are all on Eventbrite. So we are doing another weekend where someone can come in, they can have one of these checks completely free of charge. We always have some extra goodies and stuff hanging around in the clinic when we do these weekends, because I think if you show up, that deserves at least a little bit of reward. So Patrick here from Complete Health. If you know anyone that wants these, get them to go over to Eventbrite. The dates are the 8th and 9th of May. We'll be doing them inside of the clinic. People can learn a little bit more about what's going on with their posture. They can learn whether this is linked to their injuries or their problems or their pains. And then we can start to give them the options on how they can actually resolve this. Patrick here from Complete Health. Until tomorrow, I will speak to you guys again very, very soon. Take care for now.